Hi, this is Dr. Pete Butkins. I'm doing this video on marriage and drugs and alcohol. Mainly, I'm doing this video because I've been inundated over the past 2 years with couples that come in where one person is using. The key to this is finding out if the person is drug dependent, drug addicted, abusing it, using it socially. Usually, when a person comes in for marriage counseling, if there is drug and alcohol concerns, the person, if it's not dependency, the person will quit. The person will value the marriage much more highly than they do the drugs and the alcohol. If the person does not quit, that's your sign. The person is um, has a relationship with the drugs and or the alcohol. So the purpose of this video is to educate and motivate you on the subject of drugs and alcohol in the marriage and get you to see that very little will happen in marriage counseling if one of the persons is using, especially if they're addicted. The main thing to do is recognize that this is an issue. Now, no one wants it in the marriage, no one wants it in the family, no one wants it in the community, no one wants it in the armed forces, no one wants it in their schools, no one wants it in sports, so it's covered up a lot. However, if it is in those areas, which it is, it's going to cause problems. And the main definition that I like of addiction is that it's continued use of a substance despite problems. So if there's problems in a marriage because of the drinking and drugging, then the drinking and drugging is the problem. It's the primary problem, and that has to be addressed before anything can be done. If a person values the drugs and alcohol over the marriage, that's a problem. If a spouse is complaining about a person drinking, coming home drunk, falling asleep on the couch even, missing work, maybe abusing the kids or ignoring the kids, being neglectful, that's a problem. You have to define what a problem is. A problem, if someone in the marriage has a problem with the spouse's behavior, that's a problem. It's the same thing as if you had a problem such as lying or stealing or gambling or overeating. That could be a major problem in a marriage, in the spouse. If it's not an addictive or compulsive process, the spouse would look at that and get rid of it. If it is an addictive process, the person will not address it. They will defocus, they will usually blame the other person vehemently for other problems, and they'll take the focus off of the drinking and drugging and they'll put it on the other person. And this may become very, very rigid because the person's relationship with alcohol or drugs is being affected. It's being jeopardized. So the person will get really, really defensive and take a stand on it. And a lot of times this is subtle. A lot of times the person will really manipulate and not deal with the issue by making up another issue. Sometimes the kids can get involved. The kids can be scapegoated. Sometimes the kids in a family system would actually act out in order to take the focus off of the main problem because they don't want to see the family deteriorate. So you have to watch for this. And it's very difficult to diagnose this unless you've been trained. So when you do see a marital counselor, if you're looking at drugs and alcohol in the relationship, make sure they know something about addiction. Because a lot of people in my field will see a couple when the person is using, the issue just isn't brought up. Or maybe it's glanced over, or maybe the therapist will say something like, is there a problem with drugs and alcohol? And if they get a no to that, they dismiss it without really. A trained therapist in addictions will look at this issue and they will explore it and do more than just in a screening. If they see the issue there, they will do more of a follow-up assessment and maybe give the person an instrument and maybe get the people in one-on-one so they can find out more about the issue. So you have to find out exactly what you're dealing with. The general rule of thumb I like to use is that if it's in the relationship and it is a problem for you and the person's not quitting, then it's going to get worse. And the marriage doesn't have much of a chance unless this issue is addressed or unless the family gets more and more dysfunctional. Excuse me. So An alcoholic or an addict is not capable of being honest with themselves. They can be honest about some things, but when it comes to being accountable and owning problems, they'll take one of two positions. They'll either take all the blame in a self-deprecating way and play the victim role, or they will take no blame. And either way, they're not being honest in the marital session. So marriage therapy is very, very difficult to do if you're dealing with somebody that's using drugs or alcohol. And the important thing is to get in one-on-one with a therapist. If this issue isn't being addressed by your spouse, get in one-on-one, find out what to do about the problem and how you can heal yourself. I had a dinner last night, talked to a waitress. She asked me what I did for a living, and I told her, and she began to tell me a story about how her husband had gotten on Oxycontin. She divorced him this year after about 4 years. 2 kids, aged 2 and 4, I think, if I remember correctly. He's with a stripper now, and his whole line of and he's getting pills from 3 different doctors. Doesn't work anymore. He's on disability. Doesn't have serious medical problems. Is not in pain, but he's using Oxycontin, and blames her for not getting him the Oxycontin from 3 different doctors illegally. And he really believes that this is good thinking, and that he has a right to blame her, and that problem is hers. So this is how far this problem can get carried out, and how far it can progress if untreated. So just a caution, if you are doing marriage counseling and you're concerned about drugs and alcohol, put them down. Have him or her put them down. If they won't, that's a problem. Thanks for listening to me. By the way, I've got a great blog on this on my other website, www.allaboutaddiction.net, where I put a blog on this this morning. This is August 18th, 2011, and my other site is www.DocPete, D-O-C-P-E-T-E, theimperfecttherapist.com. So it's www.pete, theimperfecttherapist.com. Stay tuned for more videos, and thank you for listening. I hope you got something out of this. Bye.